Did you know that 80% of autoimmune disease is diagnosed in women? Did you know that the drugs, the medications used to treat autoimmune disease have a side effect of increasing stealth infections like tuberculosis or reactivating Epstein-Barr or reactivating Lyme disease and cancer? Did you know that there's a simple blood test that can predict your risk of developing autoimmune disease in the next 10 years? I'm talking about the test called the antinuclear antibody test, or ANA. This is a test looking to see if your body has built antibodies against your DNA, antinuclear antibodies. Traditional medicine says that low positive scores are common in the population. Well, yeah, they're common, but they go on to say that that's normal, that we don't have a clinical significance. Au contraire, if you have positive ANA, it's a predictor that within 10 years, you are at risk of developing autoimmune disease. We do know that there's about a 10-year lag time between someone getting a positive antinuclear antibody blood test and then developing autoimmune disease. Why is that? It is so simple when you think about it from the functional medicine perspective. You see, traditional medicine classifies and diagnoses autoimmune disease based on which organ system has the most damage. If it's your joints, it's rheumatoid arthritis. If it's your gut, it's Crohn's disease or ulcerative colitis. If it's your brain, it's Lou Gehrig's disease, aka ALS, or multiple sclerosis. If it's your soft tissue, blood vessels, connective tissue, it's lupus. If it's thyroid antibodies, then it's called Hashimoto's or Graves' disease, depending on whether it's destroying thyroid or causing a massive dump of thyroid hormone. These are all a collection of diagnoses based on the symptoms of which organ is damaged. But it tells you nothing about what caused the immune system dysfunction in the first place. The ANA test will be almost always positive if you have enough end organ damage to be classified as having an autoimmune disease. But not everybody who has a positive ANA, even with high titers, will have enough end organ damage to be classified as autoimmune disease. Thank God, right? Why do we want autoimmune disease? We don't. The problem is, if you wait until you have enough end organ damage, and then the only thing you have to offer is steroids, which causes leaky gut and osteoporosis and brain shrinkage, or biologic drugs that suppress the whole immune system with the side effect of cancer and reactivating these stealth infections, that's kind of scary. The thing is, I believe there is something we can do. If we identify that the immune system has gone rogue and is starting to attack body parts, and you have a positive ANA, that's a huge red flag that business as usual is not going to work. You are laying on a train track and there's a freight train headed for you, and maybe far down the track, hopefully, and you have time to get off the track before you get run over. But it means something needs to change, and it needs to change today. Why isn't this part of the routine screen? You know, we do pap smears to look at risk for cervical cancer and pre-cervical cancer to prevent it. We do mammograms looking for microcalcifications that could be breast cancer. We do cholesterol tests, which aren't very good, but to see if you have a risk of heart disease. Why don't we do ANAs to see if you're at risk for autoimmune disease? Typically, an ANA, in my experience, talking to thousands of women over 30 years in medicine, the ANA is checked when a woman keeps going to her doctor and saying, you know, something's not right. I don't feel good. I hurt. I don't sleep. I can't think. I don't have energy. Eventually, the doctor does a full, panel. Let's make sure you don't have anemia. Let's, do all these tests. And then they throw in an ANA to look for autoimmune disease. And oh my God, now the ANA comes back positive. I'm going to send you to the rheumatologist. Rheumatologists are some of the smartest people I know, but the vast majority of them are very, very traditional minded, and they don't really, unfortunately, think outside the box, over and over again in my career, I have heard women tell me, oh, yeah, I did have a positive ANA a few years ago, and I did have a consult. My primary doctor sent me to the rheumatologist, and the rheumatologist did a few tests and asked me a bunch of questions and did an exam and then said, well, you don't have an autoimmune disease. Yes, you have a positive ANA. Yes, that's concerning, but I don't really have anything to offer you. Come back when you feel worse, and then we'll check again. And if you have an autoimmune disease at that point, then I can offer you medicine. Yikes. Talk about not doing anything in time. But if you don't believe that there's a root cause, then that would be an appropriate response. And that's the huge difference between traditional medicine and functional medicine. There is a root cause. God made your immune system to fight viruses, bacteria, and cancer. And if it's gone rogue and is attacking body parts, something is wrong. And you deserve to know what it is in time to prevent the autoimmune disease. And what is it? It's not complicated. It's complex because there's many things, but it's typically caused by nutritional deficiencies, inflammation from, toxins in our environment, in our food, in our homes, high stress, trauma. So many things are at play, but so many of them are fixable. What we do is we look at what do we have control over? What we put in our mouth, what we put in our food, what we spray our garden with, what we clean our house with. So let's start there. Let's evaluate your micronutrients, your hormones. Let's optimize those. Let's clean up your diet. Let's get rid of gut inflammation. Let's clean up our environment so we are not living in a toxic soup all the time. The environment that we can control, because we can't control everything. Let's learn how to reduce our stress so that our nervous system can heal. It's amazing to me. Well, not really. It was initially. Now I come to expect it. The number of women who come to see me with positive antibodies or frank autoimmune disease, so many of them have a history of trauma in their lives because this super high stress and unresolved trauma keeps our nervous system hijacked in the fight or flight mode, and then we can't heal. And I think that's the reason why autoimmune disease is so much more common in women. We kind of internalize everything. We don't explode. So the bottom line is, ask for this test. Ask for the ANA test. If it comes back positive, please work with someone who understands that your body can heal, that understands the significance of this, that doesn't just wait for end organ damage and then prescribe scary medications. You deserve the best. I'm Dr. Yvonne Karney. I'm the hormone locksmith. This ANA is so important because it's a sign of rusty locks. And if you have a positive ANA, it means your body's breaking down. Your locks are rusty. You need help fast. Please send this to someone who needs to hear it. And if this is helpful to you, make sure to follow me and subscribe.